I can start. Ladies and gentlemen, good morning. I'm very happy to be here with you today and to debate with our panelists and also with the audience about personalized medicine and the regional dynamic. I will be your moderator today, and I'm particularly pleased to be here today as well, since I am responsible for innovation ecosystems in DG Research and Innovation, specifically in the task force which is dealing with the European Innovation Council. So this topic is of great interest to me as well, and I'm pretty sure we will have a very fruitful discussion today with our panelists. Before I introduce the panelists, may I just give you the definition of our topic of today, since some of you might not necessarily know what the topics are, what exactly is personalized medicine. So I will give you the definition, and then I will also tell you how we will structure the discussion of today and introduce also our distinguished speakers today. So personalized medicine is the use of phenotypes and genotypes characterization to tailor right therapeutic strategy at the right time for the right person, and also to detect eventually predisposition of disease and deliver timely and targeted prevention to the patients. So this is the main topic of today, and we will make the links with the regional dynamic. The discussion today will be structured around three main challenges that personalized medicine and regional dynamics are facing. And we will go more into details on the place and the role that regions can play in the whole value chain of personalized medicine, how research and innovation is translated into the healthcare, be it at national or at regional level, and also the synergies that we can build between research and innovation programs on personalized medicine and the links with the needs of the healthcare systems. So these will be our main topics, challenges that we will discuss today with our distinguished panelists. And let me then just introduce you our panelists. So we have here Mr. Professor Jan Ingvar Jönsson, who is the Secretary General of the Swedish Research Council, and also chair of the ICPermed platform. And Professor Jönsson will also go more into details on this platform right after the introduction. Professor Jönsson is also still an active researcher and principal investigator of a research group in Sweden, and in the field of experimental hematology and cancer biology. So welcome, Professor. Then we have Professor Kathleen Donk, who is a molecular cell biologist, and since 2006 also policy advisor at the Department of Economy, Science and Innovation of the Flemish government. And Mrs. Donk is also supporting strategies for personalized medicine in Flanders, and also coordinating two research projects, SAPHIR and the Smart Specialization Strategy on Partnerships on Personalized Medicine. Welcome as well. Then we have Mr. Gianni Derico, who is an international project officer and EU affairs officer at the Toscana Life Science, which is the policy support agency of the region of Tuscany. And he holds a position of EU funding officer at the Regional Foundation for Biomedical Research in Milan, and is also coordinator of the EU project Region for Personalized Medicine. So welcome again. Ms. Henriette Hansen is team leader and project manager at South Denmark office and the office representative of the Active and Healthy Aging European Innovation Partnership. And she's also head of several European projects within health and welfare innovation, and also active in an EU regional network on research and innovation, which is ERIN. So welcome, Ms. Hansen. And then we have Ms. Katja Reppel, who is Deputy Head of Unit for Smart and Sustainable Growth in DG Regio, holding the same position in previously in other DGs like DG Enterprise and Industry, and as well as in DG Employment. And Ms. Reppel worked also in the German Ministry of Economy and Technological and Tech and Council of Europe. So welcome to our panelists. And before we open the discussion of today, I will maybe just show you a mapping, a first slide that shows the place of personalized medicine in the research and innovation smart specialization strategy in Europe. So if we could have this slide on screen, please, that would... Okay, so you see the slide on screen. So here, this slide is quite interesting in the sense that it shows you that out of 135 strategies which have been analyzed all over Europe, you have 38% of regions which do have personalized medicine as a priority in their strategies. So it shows the breadth of the topic within the strategies of the regional authorities. And since this study has also been made, I think, 2 years ago, the number of these regions taking also personalized medicine as a key strategy within their policies has also increased since then. So with this picture, I believe it gives quite already a good overview of what is the place of personalized medicine in Europe, and we will also discuss what is the role of these strategies in Europe between the regions and how we can build also synergies on that. And to illustrate these priorities that have been identified and designed and how these are translated in national and regional programs and health system, let me give the floor to Professor Johnson, who will briefly present the IC Permed project. So Professor Johnson, the floor is yours.
Thank you very much. So it's a great pleasure for me, representing the IC Permed, to have this opportunity to present the activities that we have done. And I also, as you see in the slide, I'm also Secretary General for Sweden. And those of you who were very observant on the last slide saw that Sweden was actually a white box. That doesn't mean that we don't do anything. It means that we haven't really contributed to the result or to the survey. So International Consortium of Personalized Medicine is a rather new network that started a couple of years ago. And I think it's one of the key instruments for bringing together the European countries, but we also look global. And next, can take the next slide. Thank you. So you see that up there. Okay, I understand. Okay, good. So we are about more than 40 European and international partners. We represent funding agencies, the European Commission is on board, and many are also ministries. Of the more than 40 European, it's important to note that some of these, I think 6, are actually regional stakeholders and not at the national level, which is quite important, and that's very valuable for us. As you see, we do have global engagement. So we have Canada on board, Brazil, Moldavia, Turkey, and Israel, and there are other countries knocking on the door. So this has developed very rapidly as an international consortium. We are not a funding body, and I will come to that later. But on the next slide, we'll show you basically what is the base for our work. It's an action plan that was published 2.5 years ago. And the action plan is really there to coordinate and augment the activities of all the member states, but also together. And as you can see, we try to work according to 4 types of major goals. One is to basically transform research into clinical practice and to healthcare. Another one is, of course, to collaborate and to bring not to the individual and to the citizens and the patient. I think one very important aspect which is related to this session here today is that most of the healthcare providers are at the regional level. So we need, as a network, to find good examples and best practice how this can be implemented in one region and transform and transduce into others. Another thing that I think is crucial that we don't have on this slide is, of course, who are sitting on the next generation healthcare providers? Who are organizing the medical school? Who are organizing the nursing school? Who is the one that in charge of the capacity building and the training? That's the regions, because the universities are in the regions. And that's a very important aspect where the regions can make a big difference. I forgot that. So I'm very proud to say that we have also recently, yesterday, published this. This is the action plan, the vision paper that we published yesterday. It's free to download. I have one copy here that some of you may get. This vision paper shows basically what we as a consortium expect Europe to be in 2030. So it's actually like taking the action plan, that is, we update continuously, where we emphasize different questions, but now we would like to see the result and foresee and hope where Europe will be in 2030. So please download it and have a look. I think it's a good example for showing how we want to aim in the future. So next slide. It's, yes, I've been into that basically, and if you press the next, you will see the action plan or the vision paper. Good. So next slide, please. So this is, I don't have, due to the lack of time, I'm going to summarize a bit the activities that we do. I mean, we have to realize that some of the major emphasis that we have is the research community, researchers, bringing together researchers in different countries. So we do provide on the websites sort of databases for researchers and others, focusing on partnerships, focusing on funding activities, just to sort of underline what's going on, hopefully bring researchers together so they can sort of initiate. And part of this reason is, of course, to avoid duplication and overlap in the existing projects. If they are out there, it's unnecessary to start them again. So this is a very important tool. One thing that I didn't realize as its importance is the Best Practice Award that we have every year. It's a fantastic instrument, actually. I mean, it's a very small thing, but member states can nominate best practice in research and bringing research and evidence-based results into the healthcare. And those examples are really extremely important to show how do you do it? How do you transduce the results? So that is a very simple but very important tool. As I said, we are not a funding body, but we do collaborate with other initiatives. So on the next slide, show you the funding initiative that are many of the member states in ICPMed are also member of the ERAnet for personalized medicine. And so far, the ERA-PERMED has had 2 calls with a total of 60 million euros of investment, of which 50 million comes from the member states. I think that shows a very clear commitment from the member states that this is important. But I should say that we can't award all applications, of course, and there are so many great applications that we do foresee that there will be more member states on board and that we need to be more money committed to take care of all these projects. Final slide. This shows the family or the umbrella of personalized medicine and initiatives going on that are closely related. We do engage and we interact with all these, and some of them are very crucial for personalized medicine, like the 1 million genome is, of course, a fundamental question or fundamental resource for researchers in this area. But what I would like to emphasize here are the CSAs that the European Commission is supporting. On the left-hand side, you see some of them, and they will be presented now, 2 of them. And on the next slide, these are efforts to try to bring together regions to sort of emphasize what's going on there and try to collaborate between regions. And on the next slide. So I can't really read this, so I need to improvise. So why are the regions important? Well, ICPMed sees the regions as a driving force for this. Because, as I said, the healthcare providers are out there. They are the one that understands that they need to find cost-effective ways to translate evidence into healthcare. They are sitting on this. So it's not a pure coincidence that many of the regions out there have formulated their own strategies for personalized medicine. So, and another thing, as I said, I mean, I've taught a lot on medical school. We talk a lot about research, we talk a lot about the implementation into the healthcare sector, but we miss the training, we miss the scientists, the clinicians. Who is going to take care of them? Who is going to train them? But they're also out in the regions. So that's why the regions are very important. Sorry. Yes, so basically I already said it, but the last point is really, really crucial for this. The duplication efforts. Try to avoid duplication, try to collaborate, try to learn from each other. And that's why we see the regions as a strong driving force for this. Thank you.
Thank you, Professor Johnson, and thank you for also this the overview of personalized medicine in Europe, the funders, the players, and also the links that we can make with the regions and how we can build regional ecosystems and develop and implement this and run these regional ecosystems on personalized medicine. And maybe before we start getting into the debates that you also, and the key questions that you also highlighted in your last slide, maybe I would like to get from the panelists their first reaction to this picture that was given and to personalized medicine in Europe, and your relationship with the topic, be it on personalized medicine or on regional ecosystems. So if you could just indicate to our distinguished audience also what are the links with this topic.
Okay, thank you very much for the invitation to be able to share our insights and our ideas on personalized medicines to be developed in regions and to be able to contribute to all this. So the interest in personalized medicine already started in Flanders quite early, actually around the time, I think must have been around 2009 when we started talking about smart specialization. And then very early on it was realized that health and well-being were regions that were in the coming years would be transformative because of the convergence of technologies, the ability of the genomics data, other omics technologies generating a massive amount of data, also the wearables and new sensors that are being created. And it's a whole ecosystem actually that is really changing the healthcare systems and approaches that were existing at the time. So in identifying this, we realized also that we had quite a good ecosystem in Flanders to approach this new trends with in a radius of 100 kilometers. We have 5 universities linked with the university hospitals, the research centers with VIB on biotechnology, IMEC on the nanotech, Vito, which is developing novel technologies as well. We have organizations that support the industry, SMEs, a number of larger companies, pharma companies, all well represented in cluster organizations, and it is this whole ecosystem that we thought can accelerate actually in the field of personalized medicine. And that is then, but industry and academia, in fact, were advocating loudly to support their activities more. So 2018, then personalized medicine together with artificial intelligence and cybersecurity, which also in personalized medicine may have a very important role, were put as priorities for the Flemish government. And that was also the time then when we initiated the Smart Specialization initiative on personalized medicine to focus on implementation. And on the other hand, we filed the proposal for Sapphire, the CSA, on securing the adoption of personalized health in regions to address the policy level. So what we want to achieve there is to see what is ongoing in the different regions, what are the barriers and needs that regions have, and also, and in addition to what you said, also where can we find best practices that we can use to learn from. in this effort, we realize how difficult it is because there are no two countries that are organized in the same way in Europe. And it's a very big challenge. It's just addressing which level you have to go, where is the knowledge, where is the potential. And this is an effort that is ongoing now. So we started based on the results, what you showed in the risk strategies addressing personalized medicine. We tried to build on further on this and did a survey. 150 regions were addressed, I think. We have now answers from a third of them, and already we see very interesting results coming out. So I hope to share soon more information, and I would take the opportunity now to call for other regions that have not received or not filled out yet the survey. Please contact me, and we are looking for this sort of information. Thank you.
And when is the survey expected to be published, more or less?
Well, we are postponing our deadlines all the time. So we just hope in the course of the whole project to gather as much information as possible. And in the end, the idea is indeed to make it as open accessible to share this.
Yeah.
That is one of the aims in the project, actually, to, first we call it Scout, Connect, and Implement. So if you know where the activities are ongoing, you can go for implementation and collaboration. So that is the idea behind.
Thank you. Mr. Derico, if you could also tell us what is your link with the subject.
Should I use the microphone?
I have the feeling that your mic doesn't work.
Okay, so I can use this. It's bothering me. Yes, when in the first presentation we have heard that regional authorities, regional ecosystem can play a huge role in implementing personalized medicine into healthcare. That's true. Regional authorities can, in many European countries, they are the lawmaker, they are the payer, they are the policymaker, they are in charge of trainings, so they actually need to be responsible for that. So they need to understand that personalized medicine and personalized health, it's also very closely linked with the healthcare sustainability. So the reason why we have developed Regions for PerMed is mainly twofold. The first one is to call upon their responsibilities. On many different aspects. For example, the data. We have heard from many different sources that the regions that in many countries, in most of the European regions, are very active in collecting data, health-related data, in making them interoperable, harmonizing them, and they need now to valorize this data. And the regions which will never do that will be deemed as irresponsible in the next years. So the first reason of Regions for PerMed that exists is to call upon their responsibility. The second main reason is to understand how they can contribute. So which kind of policy tools they can provide even to the national authorities, to the national level, how they can cross-collaborate among each other. So this is the second reason the Regions for PerMed can work. From the more territorial and community-based point of view, I agree with Kathleen. Those are ecosystem at regional level. So industry, academy, policymaker, and citizen are very well connected. Are highly interactive. So the benefits of personalized health and medicine can really immediately translated and immediately understood by citizen and patient. So, and this is also why it is important for regions to be more and more active and to even collaborate and cross-collaborate among each other.
Thank you. May I turn to Ms. Hansen? The role of your office, of the South Denmark office, or also on the project that you are leading in relation to the topic of today?
Yeah, well, I've been invited to also to give our special input about the ecosystems. And our region has a very, very strong ecosystem. And just for the record, we just was appointed 4 stars yesterday in the European Innovation Partnership.
Congratulations.
And, specific excellence region among 6 regions in Europe. So, and that's one of the reasons is that we have this very strong ecosystem, which has been working for many years now. And we really have a system where all actors are working together, the region, the universities, training institutions, patient groups, and so on. So we are focusing very much on this broad collaboration. Within personalized medicine, it's not so focused yet, but for many years we have been focusing on welfare technologies and data digitalization, which of course is a very, very important aspect of the personalized medicine initiative. So in Denmark, it's more on a national level. We have a national strategic plan from 2017, and I think that's very important for a country like Denmark. We were just talking about it before. We are a small country, Denmark, so it's maybe easier for us to do these kind of things, but that doesn't mean that big countries like Italy or Germany could not learn from collaborating, actually, because we have a national plan, and all the 5 regions in our country are supposed to collaborate on this. So we will have a national genome and biobank, which should be open for all regions to make research and so on. And I think that's really an important aspect, to have as much data as possible gathered, so that we can learn from the processes and the flexible structures. And I think that that's very important for Denmark, at least, to have this national strategy and plan.
Thank you. And maybe if we could now have the point of view of the European Commission and Ms. Reppel, who is also dealing strongly with innovation with regional ecosystems. So please, your links with this subject, and also the point of view of the Commission on that.
So thank you very much. So I'm not working for DG Research and Innovation. I'm invited to come over from the Director General for Regional and Urban Policy, and in case anybody complains about smart specialization, I'm the one to complain to. So I hear with great pleasure that in Flanders this concept was embraced, and you really did a job beyond working on individual research projects, but to see what is beyond health per se, the well-being and things of that sort. So I take all the blame. Apart from that introduction, we had a great surprise when looking through the smart specialization priorities that the regions came up with. And it was purely bottom-up. We did not dictate to anyone, you have to specialize in that, and you don't do that. It was truly a bottom-up process. We had a great and pleasant surprise to see that health-related issues, in all their beautiful variety, personalized health included, health technology, any kind of thing which you can imagine in terms of health, that this came up almost on top of the stack of the priorities that were most frequently identified in the member states and regions. When I talk smart specialization strategy, I always talk just about one aspect of cohesion policy and one side of the funding we do, supporting research and innovation, helping industries, SMEs, and so on to become more innovative, and seize also the economic opportunities which are in there. What I hardly ever at DG Research conferences talk about is the other side of cohesion policy, which is we actually invest into reforming the health systems in the member states and regions. So literally constructing hospitals and things of that sort, funding ambulances, funding the equipment which sits in there. So for us, the health aspect is not only interesting in terms of, hey, what economic opportunity and research, but also we need solutions for an ever-aging society who sits far away in rural areas, who has an increasing range of health issues which with ordinary drugs somehow cannot be treated. So we are both on the side of investing into developing solutions and in dire need and having money to actually buy and take up these solutions. So in the smart specialization story, very early on, we were pleased to see that regions like Flanders, also Tuscany, realized that there are other regions who have similar type of things. Can we team up? And we try to support that via the smart specialization platform. This is one of the elements, via more targeted support and having a pilot action, carrying out, bringing the regions together and prepare also for the next funding period and a possible tool, an additional tool for interregional innovation investments, which is foreseen. Now, Professor Jönsson had mentioned an award, and I can't help it. I must make a little bit of publicity for our award, the Regio Stars Award, which for this year had one category about modernizing health services. And maybe these two examples, which I took along with me, are just to illustrate that we hope to have the Regional Development Fund investments at a cross-section of innovation and training, since you mentioned it. I start with the region which isn't represented here. Northern Ostrobotnia has the Oulu Sote labs, for instance. It's health labs which were built up and where technologies are tested. And very close to your heart, in Melle, do I pronounce it correctly, nearby Ghent, there is the Orsi Academy, which was supported with Regional Development Fund money, brings together doctors, scientists, engineers, industry to connect, demonstrate advanced, innovative medical technology, and it has 6 fully equipped training labs.
Yeah, impressive. We have a breadth of actors, organizations, breadth of views on on the topic of today, and experiences to be shared today. So may I ask to the panelists the questions on the debate, where we will first address the issue of the position of the regions in relation to this field. And may I ask to Ms. Hansen, what is, according to you, the added value of the regions in the personalized medicine strategies?
Well, in Denmark, as in many other countries, the regions are responsible for primary care. Yeah. So, of course, they are those who are closest to the patients. Yeah. In Denmark, we also have a very close collaboration between the regions and the municipalities, because the municipalities are responsible for prevention and rehabilitation. And I think that that is also very important when you talk about personalized medicine, because we start talking also about personalized prevention and so on. Yeah. So this collaboration is really important, being close to the citizens. And in Denmark, regions are also responsible for the regional innovation agenda. And in my region, we have this South Denmark Health Innovation Lab, where we also have like living labs and training. And I think that's a very important catalyst for getting the personalized medicine experience and research into the clinical practice. And also, as you were saying, that we also take care of the training of both clinicians, but also the health professionals. If you want to change behavior also on the ground for people working with personalized medicine, it is very flexible structure. So, of course, nurses and social care workers, they need to change behavior. And that's a very, very important task as well. And it's not easy. Yeah. So it's really important that regions have a very important role to play there.
Yeah. Thank you. This proximity, which is key. Ms. Dont, would you share this point of view and consider that regional ecosystems are really fit also to personalized medicine? Is it also...
Yes, sure. I think it is a good fit because of the proximity, indeed. But one of the challenges I want to point out again, and I have mentioned it before, is the differences between the different countries and organization in authority levels. So I can refer back to Flanders here. So the research and innovation is at the regional level. Prevention is a shared authority between regional and national level. But then everything with the implementation of healthcare is at national level. So that makes it quite complicated to have all the different levels connected at the same time, because if you have a nice new innovation, how to get it implemented? And you need to have this cross-interaction all the time. Yeah. And different countries, as I said, have different approaches and organizations. And I think this is a challenge that needs to be addressed.
Yeah, and Mr. De Rico, in relation to this challenge, is it a similar challenge for the region of Tuscany, for your region and your organization? This challenge?
Yes, it is. I mean, I think it's quite common to most of the European regions. What we are trying to do is to strengthen collaboration on certain aspects. Besides calling the regions, calling upon the responsibility of the region, what we are trying to do is also to boost the industrial sectors, especially the industrial, the small and medium-sized enterprises. One thing that we have realized that and I'm coming from the workshop of our Regions for PerMed, so there was a huge discussion on how regions can also support the territory and the territorial industrial sector. So one of the demand that came from the audience was give access to the data. We have just finalized, let's say, a pilot action among 6 regions, which for the first time are sharing clinical data, administrative data, so health-related data, so clinical, administrative, and also patient outcome data. This is very interesting, and for the first time, thanks to a huge political commitment, they are ready to share these data across regions. Well, if on the top of that we can also establish a model to provide access, so a methodology process, clean, transparent, to provide access to small and medium-sized enterprises, that would be really crucial for maintaining and this is also relates to the smart specialization strategy. This is also the key for our companies, our industries. And then last but not least, what we are trying to do is also to bring this experiment, this model within the Smart Specialization Strategy platform. So we are setting up in a project, an investment project, which is called Healthcare 4.0, which actually wants to do that, wants to explore how a model to access clinical data, health-related data, but also biosamples stored in our biobanks can be actually exploited, valorized by independent researchers, not only academy, but also industries.
Thank you. If we now consider the healthcare systems, could we say that, or how do you see how it could be made the easiest way to translate research and innovation, and specifically personalized medicine, of research and innovation on personalized medicine, how we can translate this at the regional level, and if this translation in healthcare is easier, and if it is more easy to do it at regional level. And in that context, what are the assets that region have in this relation? If one of the speakers would like to.
I can start?
Yes, you can start, and then we ask also for the other panelists.
From the experience we are gaining from the project that we are coordinating, it's easier at regional level. Yeah. But only because since 20 years, they've started monitoring, they've started collecting data. Mm-hmm. So, for example, I can bring here the example of Lombardy, but also the Tuscany. So they actually have stratified the population based on the level of chronicity of people. So they can understand where which kind of services are most requested by, are most needed by the patients. They can understand how the patients manage their own health, how the interaction between them and the physicians are carried out. And based on that, they can actually working on the health governance, they can actually change the healthcare system. This is something that the Lombardy region has done. I think it's one of the really first region in Europe doing this kind of activity. So they have actually adapted the whole healthcare system based on the needs of patient and of cluster of patient, which are clusterized by level of chronicity. Well, this is a smart approach that comes from the regional and political perspective, and this is also something that is going towards the approach which comes from science, so from more genomic initiatives, genomic medicine initiatives. So the two pathways will end up to be linked, and what is doing the policy here is making sure that when the two, let's say, pathways will match and will connect, the benefits also for this initiative will be immense.
Yeah. Ms. Handen, would you also tell us about the assets of the regions in such context?
Well, we have a bit the same in our region, that our innovation strategy is very much linked to concrete challenges with the staff and patients. But still, I mean, I think it's very important to say, of course, the regions are important because they're close to the patients. But still, it is very important to have a coordinated effort as well. And that's why I think it's again important, as I said before, that we have this national strategy in Denmark, where we have really put priorities in the research that we are making in Denmark, and that even though that the research is taking is going on in regions, one of the criteria is that it will be able to benefit the entire country. So we are, for example, having research, of course, in genome, but very important also in clinical practice, in ethics, and in health economies. So I think that's very important that you have a coordinated action, even though that the regions are an important actor.
Yeah. Yes, please, Professor.
I think it's what you say, Henrietta, is actually the key for smaller countries, at least, probably for all countries, is to have sort of the national framework, an action plan, a strategy. But the regions are sitting on the material, the infrastructures, the training, the staff. So what you need to do is have both structures at place. So the governments and the national strategy needs to be fund all the instruments that are important for the nations, whereas the regions are developing. And I think one of the driving forces out in the regions is really the cost effectiveness. And there they will find the solutions for this.
Are there other tools or instruments that that could be used, and maybe from the point of view of the Commission?
As you know, DG Regio is very much interested in helping regions to team up and helping regions to complement each other.
Okay.
What we've done in the Personalized Medicines partnership is one of the examples. Is a very good starting point for my taste. But if I may, and no hard feelings, we're not far enough with that yet. The good intentions at political level, where there's an acknowledgement and you bring together stakeholders, is one thing. The moment you tell an enterprise to reveal its data, you're talking a quite different level. And you need a legal framework which allows that and which bolsters that and makes it very, very clear how things are going. The theoretical, yes, we can share something, needs, however, also to be translated into concrete investments. I listed two because they're runners-up to our RegioStars Awards, where there were concrete investment in test labs and so on. But the other side, when I made my little show here, sort of the right-hand side, with what actually is then bought by the healthcare providers, what equipment, et cetera, what is delivered to the patients in the end, that I think would need to be more involved as the end users side, so not patients, but it's the hospital administrations, which are in many cases the end user and direct client of these things. How to give them a place? I cannot give you a clear answer to that, but definitively the investment in the deployment of these technologies to make them more cost efficient. I heard the word cost efficiency, and scale it up and have this economy of scale thing is a big issue. And in times where the public healthcare systems are crumbling financially, the better you can prepare on the research and innovation side to say, listen, ultimately, this is cheaper to have the specific, whatever, cancer treatment than having 1,000 people and half of them are dragging on for years and years and nothing helps. So the cost efficiency side, very challenging what I put out there, but I think this is really where I would love to see the regions work more together, together with DG Research, of course, to find a solution.
Yeah. And thank you. And before we turn to the to one or two questions to the audience, a last question to the panelists, and maybe Ms. Dont could also give us an insight. What are the synergies that would be needed at the level of the regions in relation to this topic? And I invite also the panelists to react quickly on this first.
I think for the synergies, that is actually echoing what you are saying. So there are definitely synergies, and people are talking and find them, and in the smart specialization partnerships. But it is true that talking is one thing, but then jump and make the next step is a different thing. So we can, from a government side, we can facilitate the joining together, but it are the industries that really have to go forward and share the data, or not only industries, it's also the hospitals. And this is a very difficult thing to overcome. It's the ownership of data, of infrastructures, how to share things. And we are in a discussion to try and overcome it, but it's certainly an effort that needs more time. And so we are very hopeful in the next framework program with the development, if it is ongoing, with what is it, the investment innovation, that one. So that would allow to develop those type of pilot and demo projects to show that it can be successful building of big projects that can really make a difference. And I think if we can reach that step, it is interregional collaboration, but it will be the whole network of regions that can benefit from that. And in the end, it covers nationwide efforts. So I think I'm a believer in the approach, but it needs a bit more time, and it certainly needs this investment program.
Unless there is willingness to have a quick reaction on this, I would propose to turn to the audience and to get the questions from the audience. So we will circulate a mic to get your questions. So I see here one question.
Thank you very much. Rafael de Andrés, coordinator of the IRANET IRAPERMED. First of all, thank you very much for the presentation. Thank you very much to Janine Barr for mentioning the IRANET in your presentation, because it's the one with the highest spending in biomedical field till now, 60 million. We are very proud of that. Also with the participation not only of European partners, also funders from Africa, like Egypt, from Latin America. But I would like to raise a different type of approach. Of course, it is very good to have the regions on board and also highlight it. But to my opinion, there is a mismatch about what a region means in the different countries. It's not the same. A region in France, a region in Spain, a region in Flanders, in Belgium. So this is also relevant regarding healthcare because how it is organized, how it is funded matters. And different regions within the countries has different arrangements regarding how to provide care. In some are primary care centers, in other are hospital-based, and so on. But what my concern is that we need not to sacralize in the regions, to think also in health regions, because matters for health is two things. One is distance in time to the services, and also population to be covered. And this depends about the different problems. It's not the same in rare diseases, in which sure a political region in the member states cannot afford that, because you cannot have an specialized for a minority problem, as on Prader-Willi or some of the rare diseases in a region. You need to have a kind of broader concept of region, that it is not matching the political region. And there is another dimension in which it matters too. It's regarding the investment. The investment, for instance, for sequencing, genome sequencing cannot be carried out by regions. We have in Spain regions with 300,000 inhabitants, and we have regions with 7, 8 million inhabitants. This is a mismatch. We need to construct also what it is not political regions, so regions for the effectiveness. That is what I wanted also to share with you. Perhaps you disagree. Thank you very much.
Thank you for sharing your experience with us and with the panelists. Reaction or comment to this? If not, I see that. Yes, please, Ms. Don.
Well, this is in fact what I was referring to. So what we try to do is, so in the statistical level, address what the region is, but then in a practical way, you have to turn to the reality, and it's different everywhere.
Okay, thank you. Another question, Mr. Please introduce yourself.
I'm Stuart
as well.
Anderson from University of Edinburgh. So, do the immediate economic benefits of stratification using administrative data, like prescribing data, for example, point to this being a more fruitful role to adopt stratification than trying to overcome the difficulties around the top-down versus bottom-up tensions in actually establishing a top-down data structure, but having essentially a bottom-up approach to treatment and process?
Comment, Mr. Derico? Thank you for your question.
So, can I repeat? I missed the central part of the question. If you can repeat. Yeah.
Yeah, okay.
Yeah,
so do the immediate economic benefits of stratification using administrative data, you used examples with administrative data, for example. I mean, one example being, say, polypharmacy using prescription data, yeah? Does that point to that approach to stratification being more fruitful in the short to medium term, yeah, than trying to overcome the difficulties of establishing something around genomic data, where you have to overcome the problem of establishing, let's say, a nationwide framework for data collection and data organization with what is essentially a bottom-up approach to treatment from the regions, because practice around, let's say, particular clinics or hospital is typically determined by the clinical body, not by any fiat by an administrator or anything like that. Okay.
I think I can answer half of this question. Perhaps Professor Jensen can ask the other half of the question. Well, what I mentioned is an example of a regional authority, a regional healthcare system, starting using data to monitor the epidemiological status of their population, to understand where the major costs are spent in the healthcare system, and try to understand how they can react. I mean, which measure they can take to reduce the cost and to maintain the same level of care, or trying to improve the level of care. So in terms of cost efficiency, which has been, I think that a wider analysis from an economical point of view has to be undertaken, especially if we should, and there is a trend that is going on, and the regions they're quite involved. It's the outcome, economical outcome, patient outcome measure. I think these also need to be well analyzed before any decision is taken in this way. So what I was referring to is an example. For the second part of the question,
Very short
Professor
answer.
Jönsson, yes,
Very
if you
short
could
answer. I
complement.
think these need to be complementary solutions. And that also shows how important it is to emphasize research in health economics. Exactly. Yeah. Yeah.
We have time for 2 last questions. Do we have time for that? Yeah? Okay, then
All right.
we will ask 2 last questions.
I'll be quick.
Please,
I'll be
Mr.
quick. Francesco Florindi, BBMRI, Eric. I work for one of the European Research Infrastructure Consortia. I was very happy biobanking was mentioned several times. We are a distributed research infrastructure. We have a headquarter in one country, doesn't matter which one, but we are working in all the 20s. My question, and the biobanks are at the local level, at the hospital level. My question is, how can an international organization, a research infrastructure like us, help at the local level regions, and how can we better connect with regional policymakers? Because right now I think there's a lot of work we're doing together, but I'm not sure that the link is done in the best way. I wonder, how can we help better to connect and achieve the goals of ICPermed?
Who would like to answer the
because
question?
of the lack of time, I would say that's another session issue.
Okay.
So what you bring up is actually for you to be part of the new partnership in personalized medicine. You should be one of the engaged in that. That's how I see it. And because of the lack of time, yeah.
If I may also quickly react, I think the one way to help is to, I mentioned the model to access data. So there is one international model which is called Codex for SMEs, which wants to explore how small and medium-sized enterprises can use biosample to produce companion diagnostics. So what I would suggest is to get in touch with the policy level and understand and help designing a model for data access, not only from academic point of view, but also from industrial point of view. So all the ethics and the privacy issues.
Thank you. A last question, please.
Yes, my name is Anna Kristín Danielsdóttir from Iceland, and I'm a user or like a stakeholder in this regard. And I really think we need harmonized databases that are shared. And I have a small example. You know, in Iceland we are 350,000. I was asked to provide growth data on my son, who has a very rare syndrome. And I had to go to 4 places. I had to go to the Icelandic National Diagnostic Center. I had to go to the National Hospital. I had to go to the local or regional healthcare station or facilities. And I had to go to the school nurses, you know, both for preschool and school. So, you know, just to obtain this growth data for the database and the registry for my son's syndrome, I had to go to these 4 places. And this is something that we need to start doing, you know, both to harmonize it, you know, so, you know, data can be shared efficiently. And then, you know, like I should be able to access all my data, you know, in one place. So I think that's where we need to start.
So my very quick comment to that is that download the vision paper that we have written, because the solution is in that. So where will we be in 2030? We need to solve it. We're all aware of it, but we need to solve the legal, the ethical, the financial issues nationally in order for scientists in Europe to use the material and the right of the individual to own his or her own data.
Ms. Nont, you wanted also to react.
Yes, I think this is a very important issue, and it's not enough addressed, so I will also check the vision paper. I haven't done so yet. But the ownership of the data is not in a company, is not in a hospital, and is not by the healthcare professional. It is my data, and I should be able to see my own data, or I can refuse to see it as well. But you should have that choice, and this is, so far, it's not the case.
Okay, then there is So thank you for your comment on this, and I'm just given the indication that we won't have any other question anymore. What I would like to thank the audience for their attention and for the questions, and I would also like to thank our panelists for their interventions and sharing of experience. And thanks a lot to all of you, and
Thank you.
have a nice day.